Hi, my name is Wendy Nuñez, and I'm a recent graduate from the MPH Public Health Program at the U of A Phoenix campus, and I'll be presenting on my internship at the Primary Prevention Mobile Health Unit in Phoenix. To begin with, I want to provide some background on the organization I worked with. The Primary Prevention MHU in Phoenix is the result of a variety of programs and initiatives. The U.S.-Mexico Border Health Commission saw significant disparities when it came to Mexican and just Hispanic population living in the U.S., especially when it came to healthcare coverage, diabetes, and so much more. So they developed a pilot project to try to address these issues. And this was later adopted by the Ministries of Health and Foreign Affairs and was called Ventanillas De Salud. VDS uses all 50 Mexican consulates across the US as a place where they can access these health services with cultural competency and at a linguistically appropriate level. And this provides preventative health services such as health screenings, immunizations, referrals to healthcare providers, and much more. To strengthen this strategy, they then decided to implement the Primary Prevention Mobile Health Unit program. And these are literal mobile health units that bring preventative health screenings and services to underserved and rural areas across the nation. In 2017, the U of A College of Public Health and U.S.-Mexico Border Commission developed and implemented the Phoenix MHU to improve health promotion and education services in Maricopa County. So this is the mobile unit. We have one in Phoenix and one in Tucson. And these units have community health workers, which we call health educators. And we also use interprofessional collaboration between disciplines such as public health, nursing, medicine, and pharmacy to really use the resources that we have on campus to engage students in the community and give them an interprofessional experience. So as we know, COVID-19 has had a significant impact on all Arizonans, especially minority populations. Hispanic or Latinos make up 29% of all COVID-19 cases in Arizona and 28% of all cases in Maricopa County. They also make up 28% of all COVID deaths in Arizona and also 28% in just Maricopa County. So starting in February 2021, the U of A College of Public Health implemented the Move Up, so mobile outreach vaccination and education for underserved populations program to utilize the MHUs to access these communities that experience barriers to vaccination to bring them the resources that they need. We started going to senior villages, rural communities, farm schools, workplaces, and so much more to get people vaccinated. Typical event, we would register them, vaccinate them, and then after the vaccine, they would be asked if they would like to fill out a COVID questionnaire while they're in that observation period of 15 minutes. And then most of our events also had diabetes health screenings in which people could be referred to a health center to find a medical home. And then in a few weeks, they're followed up with via phone call to see if they were able to make an appointment and analyze what barriers prevent them from making appointments. And then if they hadn't already filled out the questionnaire in person, then we provide them the questionnaire over the phone. And so the COVID-19 questionnaire originated in April of 2020 when Governor Doug Ducey's shelter-in-place order went into effect. And the Primary Prevention MHU team wanted to create an instrument that would assess COVID-19 attitudes and sources of information in underserved communities with a questionnaire. And this was later adopted by Ventanillas De Salud. So this questionnaire was handed out at our events in Maricopa County from April of 2020 to November of 2021. As circumstances in the pandemic changed, questions were removed or added. So it's important to note that each question has a different N or a different number of responses. The largest number to respond to one of the questions that was there for the entire period of time from April of 2020 to November 2021 was 759. As I described before, it was collected during the 15-minute observation period, as well as in phone calls for health screening follow-ups. And then all of these questionnaires were uploaded to the CICRESAL database and were analyzed with statistical software. I picked some questions I found to be the most significant and useful to discuss in this presentation. So one of the things that we asked was what was the respondents' main source of information for COVID-19 in general. Television was the most prominent source at 54.81%. And this was then followed by social media, family, friends, neighbors, other, and then radio. Next, we asked what was their main source for COVID-19 vaccine info, and television was still the most prominent at 49.5%, followed by family, friends, neighbors, social media, other, and then radio. And then when asked if they had received the vaccine yet, a total of 407 individuals responded. And this question was added when the COVID-19 vaccine had been made available to the first groups within the public. So 88.94% of individuals selected yes, and 11.06 selected no. And so we wanted to further analyze the no's. So a total of 51 individuals who selected no were then asked why. And this question was added, also added when the vaccine was initially made available to groups in public. And 49% of participants surveyed selected mistrust in the government as their reasoning. And then this was followed by other: lack of online registration, lack of transportation, problems with the English language, and I'm ineligible due to age. This questionnaire overall highlights the need to address COVID-19 vaccine hesitancy in Hispanic/Latino communities in Arizona. Vaccination hesitancy based within distrust of the government is reflected in the results of this survey of Hispanic and Latinos in Maricopa County. This prompts the need to have further research made based on government-related mistrust in this population and the effects it may have on health-seeking behaviors. The materials or the findings are useful for creating targeted educational materials now that we know the primary sources of information. And so we have to find ways to cultivate meaningful conversations and dialogue on this subject to ensure that our communities are adequately protected from this virus. Overall, my experience at the Phoenix MHU was great. I lived in Central Phoenix since I was very young. So it is very humbling and special now to have been in the position of helping and educating members of my own community. And then I would just like to thank my internship chair, Dr. Rosales, for all her guidance, as well as my preceptor, Alma Ramirez, and the rest of our MHU educators and our volunteers, as well as the Western Regional Public Health Training Center for my funding. Thank you so much.